Welcome and a good morning to all of you. I'm very pleased to be here and to have this workshop this day and tomorrow. I would like to talk about a topic which has already been mentioned, social media, and the ways in which we used it in different projects in sub-Saharan Africa to better educate, train, connect, manage, and supervise rural health workers and health professionals. And I'm very glad to share some experience today with you. And when it comes to this particular target group and to the ways in which professional development is being carried out, that we have two major challenges. Okay, good. So here we go. And one of the key challenges is that these health professionals, health workers have very limited access to up-to-date knowledge resources. And a related problem is that many of them also work in relative professional isolation. And this very much restricts their opportunities for competence development. Just consider that a large part of the learning in the workplace is by interacting with other people. And if these people are alone, then they have much less opportunities to do so. And I think there's no better picture than this one in expressing what professional isolation can mean. It's a picture from rural Malawi where I accompanied a community health worker on his rounds through the villages. And a particularly critical phase, I think this is true for many health professionals, are the first month immediately after graduation or after the pre-service training. Dropout rates are high, attrition is high. And this is something we try to deal with. Our key aspect was that we want to use mobile social media tools which are increasingly and literally in the hands of these people to strengthen professional networks and to support training or placement situations. We used a tool which is perhaps the most popular one, which is WhatsApp. And many of these health professionals, and we have been working in particular with nurses in 3 countries now with very diverse health status, South Africa and rural areas in South Africa, Zambia and Nigeria. And, but mostly all of these nurses are already having basic, simple mobile phones, and many of them, I think 95%, are able to access WhatsApp, they're owning the tool or the mobile phone to access WhatsApp. So we use these tools, and the idea is really to better connect them and also to help them to access knowledge. And what we did concretely is that we carried out several interventions. We connected freshly graduated nurses in WhatsApp groups, and we very much wanted to facilitate peer-to-peer dynamics, but we also had moderators in these groups. We circulated knowledge, updated clinical guidelines, knowledge which we thought was relevant to them when they started their job after graduation. We maintained these interventions for 4 to 6 months, and we also tried to trigger reflective practice to really better connect them, to make them think of how they're doing, what's the professional journey about, what are hardships, what are challenges, and so on. And the overall idea of this logical model was that to enhance professional development and to, in the next consequential step, to enhance the service delivery in these very rural areas. And perhaps a word about why we are using mobile social media. I think when we have resources which are in the hands of these people, it is much easier in terms of scalability, much better in terms of scalability, but also better in terms of sustainability. These are not necessarily the best tools in terms of the functional repertoire, but they're very good when it comes to, for example, troubleshooting technological problems. We were talking, for example, to nurses in South Africa, and they said, whenever I have a problem, I just ask my children or my neighbor's children, and then they are going to help me, right? We used other platforms before, and we had much bigger problems when it comes to the use of technology. So what we found, and these are preliminary findings, already the informal use of WhatsApp, the use of WhatsApp outside interventions can be associated with a number of knowledge and socio-professional indicators, which is like lower, for example, lower levels of professional isolations or higher levels of professional social capital. And also, quite interestingly, this was tied to higher levels of job satisfaction or placement satisfaction, which was quite surprising to us. This can be further enhanced by carrying out interventions, and here we have seen that the interventions compared to control groups also led to higher levels of knowledge, we measured that, and to higher levels of professional connectedness. Interestingly, one important contributor or influencing factor was not the intensity of participation, but the way in which these nurses were participating, which means that active contributors, people, professionals who were writing messages, were much more, had much a higher output or higher outcome, if you like, so than the ones who were just reading the messages. And these are first findings from qualitative investigations. WhatsApp and our interventions in general was perceived much more useful in the really rural areas compared to more urban settings. So, so far I've been talking about smaller and bounded groups. WhatsApp allows us to include only up to 200 people, but there are also massive digital platforms out there, and I give you just one example out of many which I could tell you. A couple of years ago, back in Nepal, we have been working with medical students and doctors, and we found that these students were engaged in an open Facebook site, we examined this thoroughly, and we found very rich forms of learning and professional development, which means that they shared on Facebook like mini cases, quizzes, as you can see here, but they also engaged in wider debates. What does it mean to be a doctor? What are values, norms, and so on? So very rich reservoir for learning, a similar phenomenon as we might experience from the MOOC debate, from what we know from there. And we had in this, just in this site that we studied, 1,500 interactions per week. And this is all the more surprising, I think, because this site was not tied to any organization. It was just maintained by one medical doctor from Nepal who did this in his spare time, and he was able to, or is able to, generate such a massive interactions online. Good. We have heard about all the positive aspects of social media, what they can do in terms of connectedness, even as a knowledge-sharing tool. And I think whether we want to use these tools for interventions or to leverage them more systematically or not, we have to address one aspect, which is that with or without our activities, these professionals, these health workers are using the tools anyway and on a very massive scale. Not daily, probably hourly, and not just for personal usage, but also for professional purposes. And I've seen it with all the health professionals in Europe and in Asia and Africa. So social mobile media tools are used as a professional communication tool, and I think there are also many dangers involved in this phenomenon. I want to just give you one example, which is that mobile social media can serve as a vehicle for spreading false information, misinformation, rumors inside and outside the domain of global health. Just when you think of the Rohingya crisis, which was very much fueled by debates on Facebook, but also many examples from global health. In the south of India, a vaccination campaign was very badly affected by rumors which were spread via WhatsApp, and there are many, many more examples. So what I think we all need to do is to help our learners, our professionals, to develop a sense of digital media literacy, digital professionalism. And I think this is probably as important as many other clinical, medical, nursing, global health subjects, because it's a phenomenon which is so massive. And I think only if we are able to address this and to equip our health workforce with the skill to deal with social mobile media in a professional manner, then we are able to fully and to positively leverage these platforms. I think the time is over, and I'd like to thank you for your attention.
So do we have one question for Christoph? Yes.
Any recommendations for resources around this digital professionalism? It's really beginning to challenge all schools, as you point out. Have you developed any of these kind of resources or kind of a framework for how best to deal with this?
We are in the process of developing something, but we are not yet there. So next spring, we are in our project, we are starting this because I think it's so relevant. I think what particularly would work very well is testimonials. So like when it comes to social media, we don't want to be taught by a director or by a person up in the hierarchy. We want to be able to benefit from our peers, what have they experienced. And this is why we're trying to document and to make some multimedia, perhaps video clips, which capture all these experience, and then we want to put it up. Perhaps once it's ready, but it will be in a year from now, then I can share it with this forum. And I'm not aware of any other online or other content framework or whatsoever which would be available. And this is why I also thought it would be so necessary to make a first step.
Thank you.